Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. So, every day evening we play around 50 questions of NEET PG quiz. You should get all that energy, fight, be part of the competition, and win 500 rupees cash prize by cracking the top rank in the quiz. So आज देखेंगे कौन बनेगा PG पति. We already have 16 players. Whoa. And also, those who did not log in, please go to ahaslides.com/9anon. You're able to see that code, no? To join, how you need to join, right? So please enter that code and join the quiz. And we will start. So every day evening, you have a live, interactive, highly competitive quiz of 50 questions. One subject every day. Today is ophthalmology. So let us see how good you will fight, how fast you can answer, and who is going to be the winner of the top rank, top prize. I am eagerly waiting and excited as much as all you are. I hope your preparation is really going in great guns, because Spardaya, Vardhathey Vidya, only when you fight, when you compete, then only comes out the talent, that enthusiasm. And don't forget, download the Incus app and play. There are about 50,000 question bank you can play as quiz tournaments, 2,000 HD videos, and also you have 35,000 PowerPoint slides. Every Sunday, one NEET PG full-scale grant test with discussion. Everything for a small price of 999 rupees for 3 years subscription. Wow, how cheap it is. Please tell all your friends also to join, along with hundreds of people who are getting benefited by subscribing every day to this humongous, affordable, anywhere, anytime, accessible learning content for the NEET PG coaching on the Incus app. So please download the Incus app. So let us make the great beginning, doctor. Are you ready for the game? Yes, sir, we are ready for the game. Question number 1. Look into your mobile phone, smartphone. Yes. What is this paralysis that you are seeing on the picture, when the person is looking up, looking down, looking right, looking left? Let us see who gives the correct answer. Whoa! It is a fourth nerve palsy, doctor, the trochlea. It is not sixth nerve. It is not the sixth nerve. Be very sure about. So whenever there is a fourth nerve palsy, the patients will demonstrate hypertropia, which is hypertropia when they are looking to the contralateral side and the head is tilted to the ipsilateral side of the affected eye. That is a very important clue. Now let us see. Whoa! SP, Kishore, Kirtana. Very good. Now, question number 2. Look into your phone. What is your diagnosis? You are classically seeing ocular examination. Is it a subluxated lens or iris coloboma? What is your diagnosis? Very interesting question. Let us see the spotter on clinical examination. Very good. 13 of you correctly answered. It is Iris Coloboma, SP Kishore, Akhilesh, Anju, Vikram, Sana, Dr. KP, Kirtana, Tom. Whoa, very good, doctor, very good. Please inform your friends. Even if you came late also, no worries. See, here you have ahaslides.com/9ANON. अगर आप ब्राउजर में टाइप करें तो it will let you to start joining this game and you too can start answering. Okay, so even if you come late also, no worries. Every day evening we have a 50 MCQ quiz and the topper gets 500 rupees cash prize. Paytm karo, you will immediately get the cash prize after you become the winner. So let us see, doctor. Question number 3. You are finding haziness of cornea. Now the question comes, where do you find this finding classically? Tomorrow NEET PG में straight same question image based आए तो झूठ बोले कौवा कांटे. आप नहीं बोलना कि भाई उस दिन सेम डिटो क्वेश्चन आया है नीट पीजी क्विज कंपटीशन में, बोले तो एग्जामिनर इज क्रिएटिंग ऑल creative question bank, all clinical vignette based and image based, etc, etc. Very good. 5 of you are correct, doctor. Remember, hunter ka cornea clear रहता, hurler का cornea clouded रहता. That is what you need to remember very, very clearly. Whoa! SP, Anju, Dr. KP, Tom. Absolutely ravishing. Good to see 28 online classmates. Question number 4. Now you are seeing something very easy question. Most of you should be able to answer. I'm giving you one more clue. Extra pyramidal symptoms will be found in this. Come on. Who is going to give me the correct answer, doctor? Extra pyramidal symptoms will be found in this condition. Whoa, that's right. Absolutely. So, doctor, 18 of you correctly answered. What you have seen was a Kaiser-Fischke ring in Wilson's disease. That brown red ring in the periphery of the cornea is the classical spotter you should identify. Very good. Question number 5. What is your diagnosis looking at these vesicular lesions? Do you think it is measles, chickenpox, herpes simplex, or herpes zoster ophthalmicus? What is your diagnosis? I am giving you one more small clue. Is it dermatomal or not? That is an important factor. Oh, I know. Most of you will do this wrong. What you have seen there is a non-dermatomal vesicular rash. That is the reason it makes herpes simplex. If it is dermatomal, then it is different. Now let us see who is right. Sana, Asha Yadav, very good. Neeraj, only 3 of you have correctly answered. Question number 6. What is wrong about this following clinical appearance of the caused by the herpes simplex virus once more? What is wrong about this condition? Come on, punch your answers, doctor. Will it lead to red painful eye? Is it unilateral or bilateral? Do you use cycloplegics? Do you do debridement? Wow, 10 of you are clean bold. You thought debridement will not be done for a dendritic ulcer. No, sir, it will be done. Cycloplegics are used. It's a red painful eye, but usually it is unilateral. That is what you need to remember. Oh, SP is lucky. Sana, she came up. I think I have a fifth sense saying that Sana may be a winner, winning the 500 rupees cash prize today evening. Let us see who is going to be the winner. Question number 7. Question number 7. What is your diagnosis of this HSV lesion? HSV lesion is very important. So, can you see what is it? Is it dendritic or geographic ulceration or interstitial keratitis? Doctor, those white raised leading edge of the ulcer, that is an important thing to say. It is geographic ulceration is what you need to remember. Whoa! Sana comes to the top second position. Very good, very good. Question number 8. What is wrong about this lesion? What is false regarding this lesion? Once more, this is a herpes simplex virus lesion. What is wrong about this lesion? Doctor, I know what is the most common wrong answer. So, it is basically active herpes simplex interstitial keratitis. 8 of you correct. In interstitial keratitis, neovascularization, decreased corneal sensation, diffuse white stromal infiltration, all of them. And we very much give the steroids is what you need to remember. Oh, very good. Sana answered it like a Scud American missile. Whoa. Followed by Akhilesh, Dr. KP, Sankeet, Sue. All of you are right. Now, doctor, question number 9. What is the diagnosis of this herpes simplex virus lesion? Is my question to all of you. What is this herpes simplex virus lesion basically called as? Yes. Arul and many more who lately joined little late, but better late than never when it is romance or war. Better late be rather than never. So please join by punching that ahaslides.com/9ANON. Very good. It is disciform keratitis is what you need to remember. SP is gone, but Akhilesh correctly did this. Sana also gone. Sankeet and Anju and Neeraj. Question number 10. What is your diagnosis of these vesicular lesions? I know all of you will correctly answer. Oh my God. Very good, very good, very good. Punch your answers. Very good, very good. Excellent, doctor. Excellent. So, that is right. 22 of you correctly answered. It is dermatomal in distribution. That's the reason it is herpes zoster ophthalmicus, which is the reactivation of the chicken pox. Only you need to look vesicular lesion अगर है तो dermatomal है या नहीं है, वो देखने से आपको पता चलेगा वो HSV है या herpes zoster है. Herpes zoster होता है chicken pox का, बराबर? Now the next question. Question number 11. This lesion लिम्बस एरिया में देख लो भैया, लिम्बस एरिया में ए पेशेंट को सीजनल एलर्जी है और इसको क्या बोलेंगे आप? What do you like to call this lesion? Limbal vernal keratoconjunctivitis. Wow! 18 of you are right. discrete white-gray nodules along the corneal limbus. They will be rich in eosinophils. They are called Horner-Trantow spots is what you need to basically remember. Very good. Excellent, Doctor. Akhilesh, SP, Sana, Sanket, Anju are fighting. Very good. Question number 12. Question number 12. Please look at your phone where you have the clarity picture. आपको lines के जैसे दिख रहा ना डॉक्टर? So what is your diagnosis? What are those lines they are called as? The lines that you are seeing, what are they called as? Yes. Very good. They are called Haab striae. H-A-A-B. Haab striae, which you see in the case of the congenital glaucoma is what you need to remember. Very good. SP is leading. Akhilesh gone, Sanket, Anju, and Tom. Very good. Tom is also rising very fast. Let us see. Question number 13. What is your diagnosis in this given case, doctor? And another thing, Haab striae are a breakdown of Decimet's membrane. That is what you need to remember. Now, doctor, what is your diagnosis? I think very easy question. Most of you, spotter. Come on, punch your answer, doctor. Great. 10 of you are right. Congenital glaucoma is what you need to remember. Very good, very good, very good. SP, Akhilesh, Tom are on the, oh my God, Tom is really riding very fast. I don't know, Sana, still you have a lot more questions to come back, right? Anju and Sankeet also, very good. Question number 14. Question number 14. Yes. What is your diagnosis based on this fundus appearance? Do you like to call it a coloboma, open-angle glaucoma, closed-angle glaucoma, or physiological cupping? Is a very important question. Right. Doctor, let us see how many have a good eye on fundoscopy. 9 of you are right. It is a classical appearance of a physiological cupping. All the top guys missed the game. Kirtana Jindabad, Kishore Kumar, absolutely great. Tapapriya, WHO, Aha, Vikram, Lavinia, very good, doctor, very good. Question number 15. So अब क्या करना? ये क्विज खत्म करते ही ऑफ्थल्मोलॉजी के ऊपर मोहब्बत हो जाना, राइट? रोज क्विज खेल के साथियों के साथ लड़ने से वो सब्जेक्ट के ऊपर प्यार आना, मोहब्बत लगना, राइट? That is what should happen. So, doctor, what is your diagnosis? See, juvenile idiopathic arthritis patients will have uveitis and uveitic glaucoma. So what you are seeing is an iris bombay, the protrusion of the iris because of the formation of the posterior synechiae. In the uveitic glaucoma, in a case of juvenile idiopathic arthritis is what you need to remember. Doctor, all these slides, all these PowerPoints, everything is made available on the Incus app. So our lot of students say, sir, a quiz बहुत मजा आ रहा है, रोज टॉपर बनने से 500 रुपए कमा रहे, किक कर रहे, और फिर जाके पढ़ने में और मजा आ रहे. Sir, how can we get them? How can we get all these quiz questions, PowerPoint, and all that? So it is all there on the Incus app, doctor. We are uploading it into the Incus app. Please download the Incus app and please take every opportunity to 2 2000 HD videos covering everything that you require on 953 high-yield topics for the NEET PG. So please take an opportunity today itself. Hundreds of students are joining every day. Instead of paying the 50,000, 60,000, plan A, plan B, pura bakwas hai. You just need 999 rupees, 3 years access, and every day uploaded, updated, new videos. Oh my God, there's a lot of fun to be on Incus. And only 1 rupee per day is your investment to become a NEET PG topper. On the top of it, please play the games. Every day, get active. See, what is the role of coaching, doctor? The role of coaching is to pump you with that energy, stimulate you to read. That is the job of a teacher, more than teaching, let me tell you, right? So I'm very sure. So please share this YouTube channel to all your friends, the Telegram, WhatsApp, wherever you are there, your classmates groups, and tell them 999. Some students will say, is it 999 for 3 years, only 1 rupee for the NEET PG coaching with all this video content, with full-scale grant test, with discussion and live classes every day, and so much of PowerPoint slides of notes? Unbelievable, they say. And they're all subscribing to the Incus app. So, doctor, let us get back to the game. Very good, very good. Now, question number 16. Question number 16. What is your diagnosis? See, look at the cutaneous lesion. वो देख के बताओ. और रेटिना में कुछ लीजन दिख रहा है. रेटिना में लीजन, आई में लीजन, स्किन में लीजन. अब बताओ, what is your diagnosis? मिल गया, most of the clues for you. Very good. Very good. There is a port-wine stain along the trigeminal nerve distribution. There is a ophthalmos, corneal clouding is also seen. And also there is a choroidal hemangioma. Choroidal hemangioma, which has also been shown as a diffuse orange hue in the fundus picture. That is how you identify Sturge-Weber's syndrome is what you need to remember. Very good. Good to see 33 players in the boxing show. We want more students to be in the boxing show. 30 क्यों? 300 होना है कल तक. आपके और 10 साथियों को लाओ. और everyday evening there is a boxing, NEET PG boxing show. बोल के बताना, winner gets 500 rupees cash prize instantly. Question number 17. Question number 17. So, what is your diagnosis considering that white line? That is a very important clue. So, all of you know Schwalbe's line. So, there is a termination of the Decimet's membrane. Sometimes in few people, there is a anteriorization of the junction of the Schwalbe's line, which is called posterior embryotoxin. So, बहुत ophthalmology में ज़्यादा प्यार है तो ये आंसर कर सकते हैं आप. Otherwise, normal people difficult. Anju, very good. ये सारे लोग रॉन्ग किया, आप राइट किया. Suddenly आप कल के NEET PG competition में भी आगे बढ़ेगा. So that is what you need to be very sure. But at the same time, common questions which everybody do right, you should not do wrong. Now, what is false about this condition? What is false about this condition? So fundamentally, what you are seeing in this, all of you know, all that brownness of our eyes is because of iris, pigmentation in iris. So this is basically aniridia. So there is a severe hypoplasia of the iris so that the outline of the lens is visible. So it is associated with PAX6 gene, increased incidence of the Wilms tumor, And you should know very well that it can present with congenital nystagmus, WAGR complex. W होता है Wilms tumor, A aniridia, G genitourinary anomalies, and M is mental retardation. Combination को बोलते हैं doctor. WAGR complex is what you need to remember. इसमें aniridia के साथ Wilms tumor ज्यादा होता है, neuroblastoma नहीं. That's what you need to remember. Let's see, doctor. Oh my God. SP clean bold, Akhilesh clean bold, Sankeet did one question correct, which the toppers were not doing correct. So that makes Sankeet to really run forward. Tom, Sana also picked up the scores. Question number 19. Question number 19. Wow, this is an easy question, doctor. Very, very easy question. So what are you seeing? What are these classically, these lesions called as? Come on, doctor. Yes. There are all those whitish elevated spots on the anterior surface of the iris, occurring like a concentric ring around the pupil, which is called the brush field spots, which are seen in Down syndrome. They are hypercellular, hypopigmented areas. They have no effect on visual function, no photophobia, completely asymptomatic in Down syndrome. The presence of this brush field spots is what you need to remember. Wow! SP को जरा oxygen मिल गया इस question में. Very good, very good. SP and Akhilesh, they both won 500 rupees cash prize in the last two quiz tournaments. Let us see today. Kaun banega? 500 pati. What is your diagnosis? Given this finding, what is your diagnosis? So you are able to find a inferonasally, eccentrically located, slit-shaped pupil and a persistent pupillary membrane, which is stretched when you dilated the pupil. So what is your answer, doctor? Absolutely. Ectopia lentis is what you need to remember. Very good, doctor. Good to see 35 online players. आज तो हम 50 नंबर क्रॉस करना पड़ेगा. Please inform all your friends also, doctor. Very good. Sue correctly answered. Dr. KP, Aishwarya, WHO, and Asha Yadav correctly answered. Question number 21. Question number 21. So, doctor, what is your diagnosis of this very important iris-related condition? Iris-related condition, where the iris processes are all inserting to an anteriorly displaced Schwalbe line. Good. Only by ruling out. Very good. 9 of you are right. This is called Axenfeld-Rieger syndrome is what you need to remember. Very good, doctor. Oh my God. Sankeet has shot up. He got the wings shooting up. Sana also is correctly answering. Let us see. Question number 22. What is your diagnosis? आप स्मार्टफोन में देखना पड़ता, तभी आपको क्लैरिटी मिलेगा भैया. Yes, you will get clarity. Here, lens has an opacity which is less than 1 mm in diameter. It is not visually significant. और इसको बोलते हैं anterior polar cataract is what you need to remember. Very good, doctor. Sankeet, Akhilesh, Anju. Close fight is happening. Question number 23. Now, what is your diagnosis, doctor? This large central opacity, which can be visually significant, it requires surgical removal भैया इतना क्लूज है तो आपका डायग्नोसिस क्या है? बिकॉज इट इज न्यूक्लियर, इट इज विजुअली सिग्निफिकेंट. Absolutely, doctor. 21 of you are right. Congenital nuclear cataract is what you need to remember. Very good. SP, Sankeet, Akhilesh, Anju, Tom. L is also coming up. Oh, Sana, you should not lose points. Kirtana, Sue, Vikram, MF, Meghna. Excellent, doctor. Excellent. Question number 24. What is your diagnosis? What is your diagnosis? आपको स्टार दिख रहे हैं या नहीं दिख रहे? स्टार दिख रहे ना? तो अभी आपका आंसर क्या है? सब लोग करेक्ट आंसर करेगा, मुझे मालूम है. It is not visually significant, but it can progress into a total opacity. Absolutely. Stellate congenital cataract. Wow. Good to see 36 players there. Very good, doctor. So now let's take up the next question. Question number 25. Where do you see this? भैया दिल लगा के देखो, प्यूपिल में क्या दिख रहे हैं आपको? बेटा अर्जुन, आपको एज ऑफ द लेंस दिख रहा है. एंड हाउ इज द लेंस डिस्प्लेस्ड? Lens is displayed superiorly, nasally, which is typically seen in the case of, very good, Marfans. Wow, 20 of you correctly answered. हम बहुत खुश हैं, बहुत खुश हैं. SP, Akhilesh, Sankeet, Anju, Tom, L, Kirtana, virtually all of you have correctly answered. Very good, very good. Question number 26. What is wrong about this condition? What is wrong about this condition? Come on. First of all, a condition क्या है? A condition क्या है? What is this degeneration? इस dystrophy को क्या बोलते हैं? भैया आपको अंडा दिख रहे हैं ना? यग योक अपीयरेंस. It is called vitelliform macular dystrophy, where there is a disease with retinal pigment epithelium degeneration, where lipofuscin deposits into the retinal pigment epithelium. It is an autosomal dominant disorder, and the mutation is, you get a mutation in this, in bestrophin. It is called Best disease. So Best disease is vitelliform macular dystrophy. So calcium sensitive chloride channel protein में गड़बड़ होता है, म्यूटेशन इसमें. Very good. SP, Akhilesh, Sankeet and Tom. Question number 27. Wow, I know all of you will answer this correctly. I know. If you have not answered this, आप Incus ऐप को तुरंत डाउनलोड करके पूरा ऑप्थेल्मोलॉजी को रिवीजन करना. हमने गर्मा गर्म डिस्कशन कर चुके. Almost 1,000 questions in ophthalmology from AIMS, already at PGI, JIPMER, question bank discussion had been done and made available on the Incus app. Very good. It is the bony spicule appearance which you see in the retinitis pigmentosa is what you need to remember. Very good. SP, Akhilesh, Sankeet, Anju are maintaining the leadership. Question number 28. What is your diagnosis? जरा eyelid को देखो, वहां के fold को देखो, very prominent fold. So what is your diagnosis in this given case? Very, very confusing options. Let us see. Yay! Most of you wrongly answered, I expected. Only 4 of you correctly answered. Epiblepharon. that excess horizontal skin of the lower eyelid margin pushing the cilia into vertical position. That is the clue. So most of the top guys have gone wrong. Sana right, WHO right, Tapapriya right. Very good. Abu Bakr is also right. Very good, doctor. Now, the next question. Question number 29. Oh, doctor, I think this question is already repeated. We will go to the next question. Question number 30. Yeah. What is your diagnosis given this condition, doctor? Easy question. Easy question. Very easy. Primary position को देखो, तब आपको क्लू मिल जाएगा. Primary position को देखो, डॉक्टर. Yes. Wow. Abducens is paralyzed, so primary position में adduction में आ गया. Very good. So SP, Akhilesh, Anju, Sana correctly answered. Question number 31. And always remember, doctor, sixth nerve has the longest intracranial course is what you need to remember. Wow. What is this condition? भैया कोई चाइना में पढ़ाई करे तो अगर ये आंसर रॉन्ग करे तो चाइनीज वाले जरा टेंशन में जाएगा. फटाफट आंसर करो डॉक्टर. Semilunar fold of the skin extending from the upper eyelid medially to the margin of the lower eyelid. Wow, man. Epicanthus. Excellent. So we are a very popular show in the quizzing. No other YouTuber in the world has ever tried it out. And thanks to YouTube and AHA Slides, guys, it is so easy and simple to play, right? So please tell all your friends. Every day evening, Dr. Murali Bharadwaz, unemployed MD General Medicine, will be available for conducting a quiz and giving the topper 500 rupees cash prize is what you need to remember. Question number 32. ऊपर देखो बेटा रामू, नीचे देखो बेटा रामू. रामू के आंखों को देखने से आपको क्या लग रहा है? दोनों आंखें नीचे आ रहे. They are merging together when they are coming down. So what do you call isotropia or exotropia? What do you call V pattern or A pattern? Whoa, doctor, easy question. 8 of you are right. It is a V. नीचे देख रहे तो V. That is the point you need to appreciate. And दोनों आंखें नजदीक हो रहे तो isotropia बन गया. इंकस ऐप को डाउनलोड करो. स्ट्रैबिस्मस के बारे में गर्मा गर्म डिस्कशन कर चुके. Please do the revision of strabismus. Wow, man. SP, Sankeet, Anju. Absolutely right. Question number 33. Wow. लड़का ऊपर देख रहे, नीचे देख रहे. ऊपर देख रहे, नीचे भी देख रहे. कब दोनों आंखें नजदीक आ रहे? हाँ, ये देख के बताओ. इजो और एक्सो, वी पैटर्न और ए पैटर्न. फटाफट बोलो डॉक्टर. वेरी गुड. It is called A pattern. A pattern isotropia is what you need to remember. Very good. Easy question. SP, Akhilesh, Sankeet, Anju, Tom, Sue, everyone is right. Question number 34. Now, what is your diagnosis, doctor? Primary position देख के बताओ भैया. Primary position देख के बताओ. एक्टोसिस है और क्या है? Look at the pupil also. That gives you a very important clue. I know all of you will correctly answer. Third no palsy is what you need to remember. Absolutely, doctor. SP Akhilesh, Sue Tom, correctly answered. Question number 35. Now, from here, it is very fast game. Every 12 seconds, last few questions. Gonioscopy, what are you studying? Come on. This is our make or break moment. Gonioscopy, absolutely. Angle of anterior chamber. SP on the top. The next question. In acute congestive glaucoma, how will be the pupil? All these are easy questions. Pehla first 33 were all image based questions. Yahan to easy questions. फटाफट biscuit questions है. जो जल्दी आंसर करेगा उसको अच्छा मार्क्स मिलेगा. Very good. Yup, it will be oval and vertical is what you need to remember. SP don't want to leave the top position. Then question number 37. Indirect ophthalmoscopy versus direct. It is done for. Where is an advantage with indirect ophthalmoscopy? फटाफट आंसर करना. जो जल्दी आंसर करेगा ज्यादा मार्क्स मिलेगा. 500 rupees top prize, top cash prize मिलेगा. Periphery of the retina. Absolutely right, doctor. Good. Akhilesh is punching very fast. Question number 38. कुछ भी हो सकता, नीचे ऊपर हो सकता, एक wrong करे तो gone. NEET PG exam also is like this only, doctor. Lid lag on a ptotic eye on the same side. है तो, is it a myogenic, traumatic, metabolic, neurogenic? What kind of ptosis? What kind of ptosis? Yup. It is a myogenic ptosis. अभी जरा equation गड़बड़ हो जाएगा. SP Akhilesh सब खो गया. खाली Sue correctly answered. Very good. Question number 39. Cherry red spot on the retina. It is seen in all these except. Cherry red spot in retina. It is seen in all these except. Tanima Ghosh, Syed Misbah, Pranu Kundaviti, Arul Ashwin. Please do join the quiz every day evening. Humko quiz hai. We love to see you in the quiz. Very good, doctor. It is seen in the case of the CR Vivo. So अभी आपको story समझ में आ गया. Always entrance में 60% questions बहुत easy रहता. 20% क्वेश्चन जरा सोच के रखना पड़ता. 10% टफ रहता. 10% यूजलेस रहता. यूजलेस को छोड़ देना. ठीक है. क्रोकोडाइल टीयर्स. Where do you see crocodile tears? These are all easy questions. हर एक आंसर करेगा. अगर रॉन्ग करे तो खत्म. So doctor, abnormal seventh nerve regeneration के वजह से होता है. Only SP Sankeet and Tom correctly answered. Now, last 10 questions, doctor, for the today's evening. I hope you all got that academic orgasm by fighting, competing, boxing with each other. Now, these are all seen in Cravo, central retinal artery occlusion, except, beautiful question, right? So you should know what are the causes of the painful, sudden visual loss, painless, sudden visual loss. आपके मुट्ठी में रहना वो सब लिस्टा, बराबर? Incus ऐप डाउनलोड करो. 999 rupees में 3 साल तक. Only 1 rupee you need to invest to get the coaching. 800 hours of video library. You get 60,000 MCQs question bank. Every Sunday full scale grant test and discussion. Daily live classes. Flashcards. So many things. Every day you get new and new and added up content, right? So SP Akhilesh Sankeet. Absolutely right. Now, question number 42. In NIDDM fundus examination, when do you want to do? Is a very important question. So, when do you want to do NIDDM? Very good. At the time of diagnosis, because a lot of times NIDDM, when the hyperglycemia started, no one can be able to tell. That's the reason. Very good to see 37 players. हम बहुत खुश हो गया. Now, question number 43. Cataract, easy question. All except. It is caused by all except. Come on, doctor. Cataract. Whoever punches faster answer get better marks. Good. Absolutely. MRI से cataract नहीं आएगा. Easy question, easy to guess. So all toppers correctly answer. Remember, common questions जो simple questions होता है, which constitute 60% of question paper, all toppers will correctly answer. That is the rule of the game. 20% questions में जरा guess मारना पड़ता. 10% of the questions में tough रहता, only super duper guys can answer. 10% useless रहता. That is important equation. The rule of 60, 20, 10, 10. Any entrance exam में 25 साल से entrance को देख रहा हूँ. 25 years से quarter century of entrance exams I have seen in MD entrance. Now, question number 44. 44. Colored halos are seen in all except. Yes, doctor. Where do you see colored halos are seen in all except? Easy question. Yeah, open angle glaucoma, not in closed angle glaucoma. Oh, simple question. How can you miss that? Tom only correctly guessed it. Another 5 questions, Tom ho gaya to Tom top mein rahega. These are all seen in papilledema after head injury, except papilledema. Doctor can see, patient can see. What is that condition? Papilledema. So, doctor, very good. You find afferent pupillary defect if there is any optic neuritis, retrobulbar neuritis, not in the problem in the optic disc, right? So, doctor, very fundamental question. Oh no, Vikram gone up the game. Question number 46. A neonate, 30 days old, presented with excessive lacrimation photophobia, large hazy cornea. Come on, fat answer karo, doctor. Easy question. Both lacrimal duct systems are normal. Great. 12 of you correctly answered. Oh, that keeps SP on the top. Akhilesh, Tom, Vikram. Tom and Vikram. Question number 47. Come on. 4 more questions. Who gets the 500 rupees cash prize? A mother noticed a mucopurulent discharge from the right puncta of her 3-month-old child. There's a history of watering from his right eye. What is the treatment? So you should make the diagnosis to know the treatment. Easy question. Yeah, sac massage. Lacrimal sac massage with topical antibiotics. Wow. See, most of the toppers. Tom is in the 3rd position. Let us see. SP, Akhilesh. Already both of them are the toppers in the last 2 quizzes. Tom को एक chance दे दो भाई. देखेंगे. Tom, Sankeet. Very good. Last 3 questions, doctor. Lattice retinal degeneration. Where do you see it? Lattice retinal degeneration. Where do you see that? Wow, doctor. Lattice retinal degeneration. Absolutely. Myopia, pathological myopia. What is the definition? Everything about it. You should know, doctor. So, SP and Tom. Oh no, I just jovially said Akhilesh. Just because I said you can't do the match fixing, right? Give a chance to Tom, but you also play, no problem. You can be a topper every day. Question number 49. Last 2 questions. Who is going to be the winner? Which instrument among these is not used in intercapsular extraction of lens? Come on, punch your answer, doctor. Wow. Van Greffe, cryo, and Elshing's forceps, they're all very much used. So, Dr. SP Akhilesh are still leading. The last question, which is going to decide the outcome, but almost the outcome is more or less decided. Let us see who is going to kick the ball. Polychromatic luster is seen in. Come on, easy question. Easy question. Easy question. Come on, come on, come on. And I'm so happy 35 of you have joined the today's evening wonderful quiz. Oh, only 3 of you are right. So, Dr. SP is the winner. SP Jindabad, SP Jindabad, SP Jindabad. And also, Jindabad to everybody. Akhilesh in 2nd place, Tom, Vikram, Sankit, Anju, Sue, MF, Kirtana, Sana, Vikram, Dr. KP, Tapapriya, Lavinia, WHO, Asha Yadav, Meghna. Thank you all for joining this wonderful evening, doctor. So please don't forget SP. Please send the screenshot on your smartphone to our helpline number. 500 rupees, Paytm karo. You will be the winner for the today's evening. And once more, yes, Kaustubh is asking, sir, I logged into the Incus, but it is not showing 999. So please call 9000 868 356. Please call immediately. They will give you the subscription for rupees 999, and you will get instant access, not only in the app, even on the web also. Because videos, PowerPoints, you can appreciate better on the web also. So we give both the access of the Incus app and also the web for the videos. Just 999 rupees mein sab kuch milega. Roz sham, evening, we have a live quiz with 500 rupees cash prize to the topper. So thank you so much, guys. You are all the ones who inspire this teacher to prepare every day like a student and join a session. And thank you all for coming. So please bring all your friends tomorrow. That is a promise.